Government has launched a platform that will eventually allow everyone in South Africa to register for a COVID-19 vaccine. Currently, only healthcare workers are able to get the shot, while other vulnerable groups will be next on the list. For more on the role that technology is playing and can play in the vaccination process, we're joined by Limpopo Health MEC, Dr. Phophi Ramathuba. Later, we'll be joined by the Managing Director for Cyclo 4 SA, Loiso Boyce. MEC Ramathuba, let me begin with you. Talk to us about the process of having healthcare workers register online in order to be in line to receive their vaccine. How's that going?
We must indicate that as a province, of course, because we did a lot of planning before we launch. The things have been going on well. I can indicate to you to say today it was better than Friday, and that we owe it to our planning. The reason why we had to put up a lot of planning is because as a province, we know we are a rural province wherein connectivity has always been a challenge. I think I remember, Katie, since my appointment, I have been raising these issues with network service providers that there are still some of our hospitals which do not have network connectivity. So that is why you have to, like, for instance, Pietersburg was not a challenge, but Mankweng Hospital has got a challenge in some areas in terms of network. That's when we had to look for a specific area where we would be able to access network. And secondly is the question that most of our healthcare workers, majority of them, truly speaking, they are not having access to Android cell phones, which you require those ones for you to be able to register in the electronic vaccine data system. Now, what they usually have is those old phones, because what they need is just to receive a message, and that's the reality of the situation on the ground. So that is why, as a province, what we did was to get our IT guys to be on site in that help desk, where they will be bringing the data, the router, Wi-Fi router, and also with data, and be able to assist them in terms of registration. That has been able to assist us to be able to register most of them. And thirdly, one of the challenge which we anticipated was the lack of accessibility into data. Most of our staff, I was discussing with some of our general assistant to say, my child is at the university. One professional nurse is that I'm paying university fees. I can't afford an Android phone. I can't afford the data. And that is my priority, is to give that Android phone to my son so that he can also focus and use it for his own study, which is understandable. That is why we are still making a call to all the network providers to say this is a time wherein, like you did when we started with our testing and also tracing, you were able to assist the people of South Africa with accessibility on data. And I think this time it will come handy, especially on these core critical workers that we need a lot, that if you are to provide them with the data that they really need this time around, they will be able to register. We are also asking them to say that Android phone which your son or your daughter has at home, get into the system. We've put both link in our Facebook page as the Department of Health, wherein you go and register in the Department of Health one, and then after that, if it doesn't give you that SMS which link you to can sign the consent form, go straight to the second link that we have provided, and then you'll be able to get a voucher, so that when you come and present yourself in the facility, when you already have got the voucher, it's easier, you don't take time. But we have made provisions for those who are not able to register at home. Kathy, I must indicate to say, right now, because we are still dealing with the healthcare workers, and we are only dealing with 2 facilities that have been identified, we are saying the situation will not be the same as we move to phase 2, when we'll have to deal with the 1.6 million people of South Africa, and especially the senior citizens who will not be able to even utilize these gadgets. And the fact that our rural area, it's very rural, we will not even be able to have accessibility into network connectivity. So that is why we're saying those who are really dealing with these issues of network, it will be good if you can prioritize our hospitals and make sure that we do have those connectivity so that we can be able to smoothly run this process. I can tell you, for those who have registered, when they come, it smoothly, it runs, it's able to tell you what's going on. There is no way that we can still run a healthcare system or have a hospital or a clinic without network connectivity. And I think this should be an eye-opener to all those who are really a service provider in terms of network.
On the issue of network, Dr. Ramathuba, is it the problem of the network providers, or is there a role that government itself can also be playing in terms of improving its own infrastructure? So speak to me about the kind of solutions that you have in mind for this problem.
It's not really a government this time around, because it's an issue that you have got a Vodacom, a phone, or an MTN, but there's no network connectivity, meaning Vodacom or MTN or whatever must just come and do a simple thing and make sure we do have network connectivity. That's why we're saying to them, we're not raising this issue for the first time. Even last year, when we wanted to install our PAC-RIS system in terms of our CT scans, there were challenges. For instance, in Chiridzini Hospital, we struggled a lot to get network connectivity. And we have spoken to them to say, please, can you please assist in our area? We are rural, we need that. For development to continue, we need that connectivity. So it cannot be left to say this is a government problem. This is a problem of all of both parties that we must be able to assist. We have already given them a list of hospitals that we have which are having such challenges, to say how can they intervene and for them to assist, because even to run the hospital itself on a day-to-day basis, you need that connectivity for you to be able to function smoothly.
Loyiso, let me bring you into this conversation. You've heard the various challenges that the department is speaking about in terms of what they're facing on the ground. I mean, are there easier solutions and interventions to these issues?
Thank you for your time. Thank you for having me as a guest this evening. The MEC has touched on a number of issues that are true, from the issue of connectivity. Yes, there are easier solutions, from utilizing simple solutions like mobile apps or USSD connectivity, which is the old way of that we use our parents. And back in the day, we used to charge our airtime that way, star 100 or star 147. So there are ways of I'm just glad that the technology is taking a more prominent role in terms of deploying these health solutions and vaccinations. So yes, we have a lot to contribute. It needs to be a partnered approach, though. It can't just be about government. It can't just be about the connectors, the MTNs and the Vodacoms. It's the community as well. Community members need to stop vandalizing and burning towers. We need to stop associating 5G with COVID. This is part of the problems that are causing people to not be able to communicate.
Loyiso, unfortunately, we don't have a great connection to you, so I'm going to have to leave it there with you for now. Loyiso Boyce is the Managing Director of Silo for South Africa. Dr. Ramathuba, let me come back to you and find out what are some of the interventions that you're going to be putting in place, I suppose taking the long-term view about what's going to be needed when more residents in your province now require access to these online portals.
This is what we are saying. We are trying to do, to say, putting up a lot of teams especially our IT in the Department of Health, and also some of our HR staff, to say we will have to be deploying them to even those particular rural areas wherein you'll find that there is a place where there is network. They will be able to sit there and be able to register our people. If you remember last time, I've indicated that we have already developed forms so that those who cannot, will not be able to access electronic registration, they will be able to go through the consent form manually, and then you will have somebody else to assist you by transferring the data into electronical. And I'm telling you, this is one of the area which is delaying, because we could be vaccinating a lot of people in a day, but if we still have to do the manual work, it's going to drag and take a lot of time. And also, it will also limit us. We need to say it up front. If we, let's say we wanted to use this particular community hall as a vaccinating site when it comes to phase 2 and phase 3, we will be limited in some of the areas because of that network connectivity, because we will not be able to do it in that area, which then disadvantages the communities from some of the areas. They will have to travel to an area where we know there will be network connectivity. So that's why we are saying it's not yet too late. We can still get support from the partnership and be able to say we've given them areas that we are thinking we've identified to can utilize them for vaccination. In the meantime, while we are still waiting for the phase 2 and phase 3, we could still be providing those solutions for us not to be able to have those challenges. Because, you know, I spent the whole day yesterday and today with our nurses, and they are so relieved that for the first time they've got to do their work, which is to vaccinate. They don't have to fill in paperwork like they would do on a day-to-day basis at their workstation. And they would say it makes them to be focused, and because now they've got people who come in with the vouchers, and somebody, the data capturer, verifies, and after verifying, you move to the nurse. All what the nurse does is to cancel you. This is a vaccine. This is what it's supposed to do to you, and inject you, and then you move. Another patient come, and that is running smoothly. And we believe if we can be able to achieve the systems that we've put in place for both Pietersburg and Mankweng Hospital, we will be able to achieve in all the numbers that were expected. I think the 67% that the president has pronounced on, we can be able to achieve as South Africans.
MEC, before I let you go, let's just talk about Limpopo's response then to COVID-19 right now. Of course, we recently had the reopening of schools and a lot more activity taking place. What is the testing in the province like right now?
Now, the testing, it's continuing, but we must indicate that, as you have seen, even throughout the country, we have begun to stabilize. The numbers have gone down, and even our admissions have gone down. We are just only still experiencing some of the death, which, you know, that's how this pandemic is. Even when it has stabilized, you might still record some death. But also the other number of deaths that you see us recording would have happened in the peak of the pandemic, but the validation of all the consolidation of all the stats, it's only currently happening now. And that's why you can think that maybe we're having more people dying this time around, which is not necessarily the case. So, but otherwise, we are working closely with the MEC for Education. We are providing that technical support to them in terms of what is needed for them to be able to open their schools. And we always are confident that when our learners and our teachers are at school, we are able to provide much more protection than when they are at home, because at school, we're able to have monitoring, but when they're at home, people have got all sorts of gatherings which we do not have control over. So for us, we are confident that through the work that has been done with the two departments in preparing the learners to go to school, our learners will be able to go to school, and we do not anticipate that we will be having serious challenges. We'll continue to support them and provide that. And what is currently interesting is that when you already have the vaccine roll out, the morale, if you are to see the morale of the doctors themselves now, it has been boosted. When you speak, you talk to the nurses, they are waiting. They want to fight this pandemic now. The enthusiasm is there. You can see that we are now working throughout Saturdays, Sundays. They are all at work, and most of them are volunteering, even our private sector, because this weekend we allocated it for private sector. Our GPs Yesterday, 99 of them have been vaccinated. They are all really eager to work, and even private hospitals like Netcare Puluso, we work with their manager. The hospital manager has been with us from Saturday. Even now, he's still at work with us. We have vaccinated them. So they're saying there is hope that now government has prioritized our immune system so that in case we get to wave 3, we are ready to fight it and will be able to fight and protect the lives of the people of Limpopo. So for me, I'm saying where we are now, there is light at the end of the tunnel. I'm encouraged by the spirit of working together from all sectors.
Right.
It's no longer about in private or I'm in public. It's about I am running the healthcare system of this country.
Let's leave it there for tonight. Limpopo MEC, this is the Health MEC, Dr. Poppy Ramathuba.